Hello and welcome back. This week we're going to go over caffeine and alcohol, which is pretty exciting for me because I typically am not able to go into this topic in my line of work, but it definitely these two chemicals have a very strong impact on overall health, and there's a lot of science behind them. So in this chapter, what we're going to do is we're going to take a look at the physiology of caffeine and alcohol. We'll look at their effects on hydration. We'll talk about some of the pros and cons, look at the guidelines for intake, look at the calorie content of different sources of each of these chemicals, amongst a few other things. So without further ado, let's get into caffeine and alcohol. So we'll start off by going over the effect of these two chemicals on hydration status. Before we talk about how caffeine and alcohol are going to affect our hydration status, we have to talk about how hydration is regulated by the body itself without these two chemicals involved. So first of all, whenever we are dehydrated, what's going on is we're going to have a decreased amount of blood volume because blood contains large amounts of water. So when we have low amounts of water in our body, blood's going to drop. That shouldn't have too much of an effect on the solutes that are in the blood, like electrolytes, sugar, things like that, except their concentration, the amount of them per the blood that's actually flowing through the body is going to go up. So about the same amount's going to stay, maybe a little bit less, but their actual concentration is going to go up. And when that happens, that signals to the pituitary gland that we need to conserve as much water as possible. And so what you have is the antidiuretic hormone that's released, and the antidiuretic hormone is going to tell the kidneys to conserve water that we have. So diuretics, what those are things that cause us to get rid of fluids. So the antidiuretic has the opposite effect. Instead of getting rid of those fluids, it says, hey, we need that. Kidneys, don't get rid of it. Let's hang on to that for right now. And so basically what happens is when you have that low blood volume and a high solute concentration, you're dehydrated, and the antidiuretic hormone is going to be released then, and it tells our kidneys to hang on to that water so it doesn't flush it out and we don't pee that water out. So as a recap, the ADH, or the antidiuretic hormone, that causes us to hang on to water when we need it. Basically what caffeine and alcohol do is they inhibit the release and the effect of the antidiuretic hormone. So instead of retaining the water and fluids that we need, we end up just continuing to get rid of it. So diuretics cause the release of urine, and that's why after you drink coffee, or drink beer or some type of liquor, you're going to generally pee more. Not just because you're consuming more fluids, that's going to cause that to occur too, but also because you're more likely, with the antidiuretic hormone not working, you're more likely to continue to release fluids. Now let's go ahead with this second section. Let's go ahead and highlight and hone in on alcohol. First and foremost, calories. Alcohol by itself has calories. So you might have a drink that's just alcohol, zero carbohydrates, zero fat, zero protein, but it still may contain a significant amount of total calories. And that's because compared to the other macronutrients, alcohol is a bit higher quantity of calories per gram. With protein and carbohydrates, they both have 4 calories per gram. Fat's on the high end, it's got 9 calories per gram. Alcohol is not too far away from fat, 7 calories per gram of alcohol. And then caffeine by itself, 0 calories. But alcohol, even without anything else added to it, has quite a few calories. This slide takes a look at the calorie content of different alcoholic beverages. So for a light beer, that's generally going to provide around 100 calories. A darker beer is going to give you somewhere between 150 and 200 calories. A 4 to 5 ounce glass of wine is going to give you about 80 to 100 calories. And then take a look at the far right of the screen where it highlights hard liquor. Just a shot, a 1.5 ounce shot of various types of liquor is going to provide about 100 calories. And I remember when I was in college, I had a lot of friends that would take shots of some type of hard alcohol throughout the entire night. And they would do it because it didn't have too many calories. But when you look at this, you'll see that a single shot, even though it has a very, very small amount of liquid compared to something like a beer, like a 12-ounce beer, it's still going to pack quite a few calories, and that's because it contains a lot of alcohol. And each gram of alcohol is going to provide 7 calories. So 10 shots is going to give you about 1,000 calories. Let's take a look at some of the health effects of alcohol intake. It is certainly true that there are some benefits to alcohol consumption. However, these benefits are only for moderate intake. What that means is for men, 1 to 2 alcoholic drinks per day, and for women, no more than 1 alcoholic drink per day. So some of those benefits, our body is able to use and utilize insulin a little bit more effectively, and that increases insulin sensitivity, or the ability of insulin to pick up sugar, and that is going to lower our risk of diabetes. We're going to have an improved blood lipid profile, which basically means that we have an increased risk for heart disease. There's a reduced risk of rheumatoid arthritis. We have a reduced risk of developing gallstones and also of kidney stones. Now, on the other hand, when we start to exceed this, we're more likely to have some psychological issues that occur. This includes things like irritability, antisociality, depression, anxiety, panic, psychosis in very, very high alcohol intake levels, hallucinations, delusions, sleep disorders, and then also some damage to the major organs, which can cause scarring of the liver, can cause some heart complications, it can cause severe stomach pain, pancreatitis, and also an increased risk of type 2 diabetes. Alcohol has a very significant impact on the liver, especially if we have it in very large amounts for a very long period of time. And the reason this is because the liver is the processing center. All the nutrients that we consume, our liver is going to process and decide what needs to happen with those nutrients. And this also includes medications, illicit substances, and alcohol. And the liver is going to clean the blood of toxins. So if we have a moderate intake of alcohol, our liver can handle this. However, excess intake is going to overwork our liver, and it's going to destroy liver cells. And if we do that over time, it's going to impair nutrient metabolism and blood cleansing to a very significant degree. With years and years of excessive alcohol intake, you're initially going to get something called fatty liver. Then you're going to get something that's a little bit more significant, liver fibrosis or hepatitis, which is inflammation of the liver. And if alcohol intake continues in excess quantities, at that point, after a few more years generally, you're going to get actual scarring of the tissue where you have permanent damage and the liver is not able to do its job very well, and that damage that occurs is not reversible. With liver disease, what happens is you go from a nutrient processing center that's able to effectively get rid of toxins, alcohol, process nutrients effectively, to something that is scarred and does that same thing but very, very inefficiently. And this can occur within a 10 to 15 year period of excessive alcohol intake. Cirrhosis is the final stage of liver disease, and it's very significant because the toxins and the waste products that can build up in the liver, they get to the point where it can be fatal because the liver is just very, very poor at getting rid of those things. So about 50% of people with the diagnosis of cirrhosis or liver scarring, they're only going to live for another 10 years unless they get a liver transplant. And then 35% of people with cirrhosis are only going to make it another 5 years without that liver transplant. There's a condition known as ascites that's common for people with cirrhosis, and this occurs, it looks like a person has a very swollen stomach. And what's going on here is pressure in the liver's blood vessels is going to increase, because as blood is flowing through the liver, it's blocked. It's blocked because of all the scar tissue that's in the liver. And so this causes fluid to be released from the liver into the stomach to the point where you get a large amount of swelling. What people with cirrhosis should do is they should limit sodium, because sodium attracts water, and that can increase the pressure in the liver and cause ascites to occur. They also have to eat a lot more calories and protein. Typically, people would have 25 to 30 calories per kilogram of body weight. People with cirrhosis may need upwards of 40 calories per kilogram per day, which is very, very, very high. For protein, they typically normal adults need about 0.8 grams per kilogram of body weight. In the case of cirrhosis, they need 1.0 to 1.5. So in some cases, almost double the amount of a normal adult. And in cases of ascites, this goes up even more. And that's because the liver is very inefficient at processing the calories and the protein that it gets because of the scarring that's going on and the impaired metabolism. All right, we'll move over to a little bit more of a short-term overview of what happens with excess alcohol intake by talking about some of the things that go on in the case of a hangover. So first and foremost, dry mouth and excess thirst. That's common because we tend to be dehydrated from excess ethanol intake. Nausea or upset stomach. That occurs because alcohol irritates our stomach lining. Acetaldehyde is an ingredient in alcohol that's kind of a poison to us. And so an excess intake of that can cause anxiety, it can cause impaired thought processes and cognitive function. If we have a headache after drinking, that is actually because our body recognizes that either it's dehydrated or it's at an increased risk of dehydration. And so the blood vessels that are around our head, not necessarily the ones that are in our brain, but the ones that are around it, they tend to constrict when we're dehydrated. They open up in an attempt to promote increased blood flow. So that opening of the blood vessels is going to create excess pressure that's linked to that headache. And then excess alcohol intake is linked to impaired sleep. So that deep, restful sleep, the REM sleep, is thrown off when we drink in excess quantities.